Hello everyone, in this video I've decided to discuss about medications right. If you mess up medications right, nothing else matters. As a nursing student, as a nurse or new grad, this is non-negotiable concept in nursing. We need to be clear and confident about medications right. So in this video I try to simplify the medications right, and hopefully by end of this video you will have clear knowledge about medications right. So what are medications right? In general they say we have 5 medications right, but in real life I want to say we have more than that. So let's go ahead and emphasize to the important medications right. First, right patient. How do I know that I'm having the right patient? Of course, we know our patients, right? Hopefully, we do. But before giving medications, we need to use right identifier to identify our patients before administering any medications to them. So in order to do that, we need to use 2 identifiers. But I want to be clear, room number, it doesn't count as an identifier, okay? So make sure to ask your patient what is their name and what is their date of birth. These 2 count as identifier. What about right medication? In order to identify right medication, of course, we have to read our order to make sure that what we are going to administer, then we are going to the system that dispenses the medication. It depends what system you're using at your hospital, either Pyxis or Omnicell or other systems. Make sure to identify medication there. And then the second time is gonna be when you are retrieving the medication in the med room. So read the label, and then during the preparation of medication, and last time before administering that medication to your patient, read the label again. Perfect. Then what about the right dose? Of course, it's gonna be at the at the system and also in your order. Read your order carefully. And for the high alert medications such as magnesium sulfate, insulin, and oxytocin, you're gonna need another nurse at the bedside with you to witness that, to double check and make sure patient is going to receive the right dose. What about the right route? Especially in today's world, we have medications coming in different format. Either they are in form of vial, solutions, IV solutions, or capsule and tablets. So you need to make sure to know that if this medication needs to be given in form of PO, meaning patient needs to take by mouth, or needs to be in form of injection, IM, muscular injection, or sub-Q under the tissue, or IV through their IV solution. So all of these are important. Please make sure to read your orders. And then right time. So you need to know how often and what time this medication needs to be given. Again, I'm sure it's going to be included in the order. If not, reach to the provider. But in general, we have either around the clock or daily, or BID, meaning patient needs to take it twice daily, or TID 3 times daily, meaning probably every like 8 hours, or every 6 hours, or every 12 hours, or every 24 hours. Read your orders because it's gonna be different. And then beside all of that, I want to mention that we have other rights too. For example, right documentation, right assessment, right education. So of course, after giving the medication to your patient, you need to make sure you document everything properly based on the guidelines. And also right assessment. I want to emphasize to right assessment because we want to make sure before administering any medication, we need to assess our patients, because having an order doesn't mean that the nurse needs to go ahead and give the order. Nurse needs to always assess the patient before giving any medication. Because yes, I may have orders, for example, for insulin, but based on my patient's condition, if my patient is symptomatic and I check the sugar level and I find that the glucose is very low and patient is in hypoglycemic condition, do I really need to give that insulin? Probably not, right? Because it's already a red flag right there. Maybe I need to hold it, reassess my patient, stabilize my patient, and report the condition and situation to the provider. Or if I have order for blood pressure medication that also lowers the heart rate, you go ahead and check your patient, assess the vital sign, and you find that your patient's blood pressure and heart rate both are very low. So you have a red flag. So you have to pause, think, and reassess, and probably you should hold the medication. And of course, notify the provider. Or in labor and delivery, there is a medication they call terbutaline that is usually given to reduce the contractions frequency. And this medication is increasing the heart rate if your patient is already in tachycardic situation. So that's a red flag. You cannot give that medication, right? So always make sure that you assessing your patient, and always if something is not clear, you need to verify that and ask question. Asking question, it's not a bad thing. It's always clearing stuff and you become confident. And as a confident nurse, you are gonna save your patient's life. So always make sure to be clear about what is going on and what the order is. And I want to say always in NCLEX question, when you are reading questions wants to make sure that you are able to save your patient's life and you are always thinking outside the box. So always make sure to assess the patient before giving any medication. So I hope this video cleared everything about medications, right? If you enjoyed, please give us a thumbs up, subscribe to our channel, and go ahead and share this video with your classmates